okay? And so some of the messages that we've heard over the last 2 days can be a bit thought-provoking, and we might think, oh yeah, okay. Is acceptance the way to go for pain management? And some of us will say, oh yeah, right, okay. I'll go along with it, but I'm not sure, actually. So let's have a look at our patients. There are some concepts and ideas. I'm going to run through this fairly quickly with MI. The first is that Miller was a very good observationist. What he did was he saw, and he's the developer of motivational interviewing, he was watching people who were required to attend for alcohol counselling, and he was watching what worked. And what he saw was different responses depending on the style of the person carrying out the therapy. What he found was that those that evoked the person's own motivation and empathised instead of pushing back managed to get better outcomes than the ones that said, you've got to. You realise you'll end up in jail if you don't start drinking less. And he developed this really on 3 concepts. And I'm taking this mainly from a paper that Miller wrote in the 90s. Sorry, I don't have the reference on this slide. I deleted it. I've gone through this presentation a few times. Slides fall off. So cognitive dissonance is that we have an inner drive to hold all of our attitudes and beliefs in harmony. And so when we're given something that contradicts with what we believe, we have this dissonance. We just don't feel quite right. So when someone tells us to do something we don't really want to, we fight back. But then we also know that self-perception, when I say things, we like to behave according to the things that we say. And he also drew from Rogerian therapy, which is this interpersonal warmth, that being a nice, warm, listening, supportive person is really influential in terms of how well people will go along with what we say. And what he found by observing these people that were doing this kind of therapy were 2 important processes. One was technical, we'll talk a little bit about that, and the other is relational. So the technical processes were reinforce the kinds of sayings, the things that people were saying that you want more of. So yes, well that sounds great. And empathise when you hit resistance. When somebody rolls their eyes, when somebody says yes, all right, but. Anyone had yes, but clients? Yeah? Yeah, I have too. So those were 2 technical processes that he analysed. And then there were these relational processes about being empathic. How do you demonstrate empathy? And how do you demonstrate this positive regard that you're actually okay, person sitting in the other seat. You are not a pain patient, you're actually a person. And I think you're amazing. And when he looked at the technical processes, what he discovered, and I won't point arrows, was that therapist empathy and spirit, combined with using these particular techniques of reinforcing talk that was along the lines of the direction that you want to go, and empathising that resistance, increased change talk, the person's utterances saying, oh, I'll do this, I might try this, this is a day I'll try it, and reduced the occurrence of resistance. And these led to 2 pathways. One was a greater commitment to changing, maybe a time and a place, and the actual occurrence of making changes. That's pretty cool. What I liked about this was observing people, therapists doing therapy. So it came from observation, and I'm very keen on that because as clinicians, we sometimes forget that what we observe and what we do might be unique and worth following up in terms